My name is Krashna Patel. I'm an upper gastrointestinal surgeon here at West Suffolk Hospital, and I'm pleased to announce that we have an exciting new surgical robotics program that will be starting later this year using our newly purchased CMR versus robot. Having a surgical robot at West Suffolk Hospital will very much change our practice in terms of what we do at present. The traditional open and keyhole or laparoscopic surgery, a lot will be moved over to the robot, and this allows us to perform operations with more precision, flexibility, and this will entail a better clinical outcome for our patients. There are many specific benefits the robot brings to our surgical practice. We use smaller incisions compared to traditional open surgery. We can use smaller instruments through our traditional keyhole ports used for keyhole surgery at present. And ultimately, we have more precision and flexibility in terms of performing the procedure itself. This will lead to less complications, less blood loss throughout the procedure, the ability to operate in smaller areas such as the pelvis and up in the chest, and this invariably will lead to better clinical outcomes. It is of the utmost importance that we have this technology at West Suffolk Hospital. Not only will it mean that for our local population we can do innovative surgery, but it also means that we can deliver that type of surgery here, as opposed to patients going to larger hospitals such as Addenbrooke's hospitals or Norfolk Norwich Hospital. This will serve our population well and will bring our hospital into the future in terms of the field of surgery. Using the CMR versus robot, the surgeon who will be operating will be sitting at a console in the corner of the theatre and will have full control of up to 4 arms. There will also be an assistant at the bedside of the patient to ensure safety. The training for this type of robotic surgery is rigorous and takes months, and safety is of the utmost importance, and therefore only when those surgeons are ready to operate will they be using this on patients. We have full control while using the console, and as mentioned, there will be an assistant at the bedside in case there is an issue where we need to convert to an open procedure. And safety again is of the utmost importance. Being a surgeon and working in a theatre environment can be very exhausting at times. It does involve a lot of standing up and bending over. With the CMR versus robot, the surgeon will be comfortable sitting down at the console. They can operate standing up if they wish to do so. The state-of-the-art equipment within the CMR robot will also allow ergonomic movement of the instruments within the patient, and this again will be very comfortable for the surgeon. Eventually, we will be able to perform surgery quicker, and therefore this will lead to a more effective and efficient list and reducing fatigue overall in the theatre environment. There are very few trusts in the UK who currently have the CMR versus robot, and this exciting technology is at the pinnacle of surgical innovation. This will invariably attract new young consultants who have finished their training to come to West Suffolk Hospital, and that will future-proof our surgical department moving forward. It is very important that we support our local population, and a very much part of maintaining and keeping this robotic service is donating money towards its cause. This robot will be used to save lives, remove cancers, and treat countless number of conditions within the field of surgery, and therefore I would encourage all of us as a population of West Suffolk to donate kindly to this cause.